I thought I'd start a series called The Medical Diaries just to kind of share different diagnoses that I've collected over the years, as I know that sometimes when you're first diagnosed with the condition, it can be quite scary. I know that when I was first initially diagnosed with the brain tumour, it was so overwhelming and scary, and I couldn't really find many resources. I have been sharing my story on TikTok, and I have had quite a few people reach out to me from there to like ask questions and get reassurance. So I thought I'd also share my story here on YouTube. So in this video, I'll just talk about the initial diagnosis, what my symptoms were up to the point of getting surgery, and then in my next video, I'll talk about surgery. So I was diagnosed with a pituitary macroadenoma in August last year. Initially, they thought it was a Rathke's cleft cyst because it had like fluid in the scan, but it ended up being a tumour that was partially cystic. So there are two types of tumour that you can have. You can have a microadenoma, which means that the tumour itself is less than 1 centimetre in size, or a macroadenoma, which is what I had, which was more than a centimetre. So I think initially my scan was like 12 times 14 times 14 millimetres in all directions. So it's bigger than a centimetre in all directions. So the pituitary gland is outside of your brain, it's just below it, and it's like a pea-sized gland, and it controls a lot of hormones. I didn't realise how vital it was for your body, but basically if you have this tumour, it can kind of go in two directions. So it's kind of like in the middle of your brain, so it can go towards your optic chiasm, which will then cause blindness, or it can go the other way into the pituitary gland and cause hormonal issues, which is what I had. But by the time that surgery came about, it was going into my optic chiasm as well. So I started experiencing symptoms in, I'd say, like January 2025. My headaches were getting worse over time, particularly behind my eye and at the base of my skull. By the time I got the diagnosis, I ended up having to like nap every day, and I've really struggled with reading and focusing on screens for a long period of time. Normally with this tumour, you kind of find it by accident and you don't necessarily get symptoms. It's normally found later in life, like when you're in your 50s and 60s. So the fact that I had symptoms and I was so young is quite uncommon. That being said, I didn't actually go to the doctors for the symptoms that I had because I have endometriosis, and I just thought that the symptoms that I had would kind of be like brushed off and be told that it was just girl problems and something that you have to deal with, and in actual fact it wasn't. I was also experiencing a lot of fatigue alongside the headaches, but again I just thought that was part of endometriosis. My bra cup size also increased, like completely out of nowhere. The rest of me hadn't put on enough weight to justify the change in my body so much. I think I ended up going up like 3 or 4 bra sizes just out of nowhere. Another symptom that I experienced that again you wouldn't associate with having a brain tumour was the fact that my menstrual cycle started changing. So although I had endometriosis, my cycle would be regular every month and I knew when it would be. I think initially it would be like 3 to 4 days late, and then at one point it ended up being like up to 2 weeks late, which was completely unheard of. Also, as the tumour continued to grow, so after the diagnosis, I did experience like stroke-like symptoms a couple of times, and that ended up getting my surgery date pushed up. So I couldn't control this eye, and it was really drooping. I think I've got a picture, I'll add that here, but yeah, basically like I could open this eye, but this one wouldn't move. And again, as my tumour continued to grow alongside stroke-like symptoms, I was starting to get double vision more regularly. I think it started going onto the optic chiasm nerves. So yeah, I was experiencing double vision quite a lot, and I would end up getting migraines where it would just be pure blurry vision. I wasn't able to see anything properly. So the brain tumour was actually found by accident. As I said, I didn't go to the doctors for the symptoms that I was feeling, but I had a blood test which covered a wide range of things that don't normally get covered, and one of the things is prolactin. So prolactin is a hormone that your body makes when you're breastfeeding and pregnant. Normally, if you're breastfeeding or pregnant, your numbers are about 300 to 400. And when my results came back, mine were about 1300, so like over 3 times what it should have been. And I wasn't pregnant, I've never had a child, so it was very strange, but that's the reason why my cup size was increasing. So once the results came back and the prolactin level was high, I was then sent for an MRI, as normally what would happen is if your prolactin is high, it normally is a brain tumour. So initially my doctors would have wanted me to wait a couple of weeks to get tested again for prolactin, and then if it was still high, then they would have wanted to get the MRI, but I pushed back and said, actually, I am experiencing a lot of headaches and the symptoms I have are in line with what the symptoms are for a brain tumour, so please could I be put forward? So yeah, we ended up getting the MRI, and then they normally said like you'll hear back within a week or 2, and 2 days later I had a call from the hospital just to double check that my details were correct, because I think it was a bit wrong on the system, and then the doctor called the next day to obviously give me the news. So when the GP called me, he just initially was kind of just double checking what my symptoms were, being like, so you're experiencing headaches, where are they, all this kind of stuff. And they said, yeah, we found a growth in your brain. Explained like the size of it, and normally what would happen is, because it's a macroadenoma, so because it's more than 1 centimetre, they would put me forward for surgery. I'm not going to lie, it is such a scary diagnosis to get, especially in the beginning, and you're not sure if it's benign or cancerous, but they reassured me that it would be a benign tumour. But obviously it's still in a place that you don't want it to be, and it was just so uncertain. And you've just got all these thoughts racing around in your head. Normally, if you have this tumour, again, like I said, you don't really get symptoms, so most people won't need the surgery. It's only if it's bigger than 1 centimetre and causing problems, for example, hormone issues, or it's going into the optic chiasm, which is then going to cause blindness. And also what will normally happen as the first point of call is they can put you on medication to kind of shrink the tumour, but because mine was partially cystic, this medication won't work on that. So regardless, I was going to have surgery. So because the pituitary tumour causes hormonal issues, you'll normally be put under endocrinology for any hormonal issues long term, but if you're going to have surgery, you'll be referred to neurology. But neurology is normally like a specialist unit, so my hospital's over an hour away to be able to speak to a neurosurgeon. But in terms of endocrinology, I can go locally, and I will go locally long term. So if you're diagnosed and you end up going to see the neurosurgeon, you will have some tests to do beforehand. So obviously you'll have the initial MRI to find out like how big the tumour is and how it's affecting you. You will also have eye tests, which are quite in detail. They'll do like scans and just check your vision and see if it's going to continue to have any issues, but also just see if it's impacting the nerves or anything. And then what else? You'll also have additional blood tests just to check the hormone levels of everything. And obviously my prolactin was high, and then I think initially my cortisol level looked a bit low, so I had to redo and have like what's called a short synaptin test. So you go in the morning, they take your bloods first thing, and then they'll inject you with like a synthetic cortisol, which is the stress hormone of your body, and then they'll check it like half an hour or an hour later just to see if your body is creating it as it should. So yeah, I think they're kind of like the only other tests you've got to do. I think I was initially put on the waiting list for surgery around December time because there were some issues with how I was referred initially. I was sent to the wrong area, so it was a couple of months until I got sent to the right place. And then I ended up getting surgery at the end of April. But what I will say is that I did have to push to be prioritised. I think normally they say they try and leave it for 6 months to see how it impacts you. But as I was saying, my tumour continued to grow, and I started to kind of lose my vision. And so after the next MRI, it had grown a bit, and they did say in a letter that it would be in the not so distant future that I would start to lose my vision. As the tumour continued to grow as well, obviously I was having more regular headaches. As I said, it was behind my eye and the base of the skull, but it also felt like an intense pressure that I can't even describe, and I was having migraines every day that were causing really bad nausea and vomiting just with the pressure in my head. I don't even know how to describe it. You just want to get like an ice pick and just like stab yourself basically to try and just like pop or relieve the pressure. But yeah, since surgery, that pressure's completely gone, and I can't tell you how much of a difference I feel. Also, if you are diagnosed with this is something that you will have to live with for the rest of your life. So even if you have surgery, there is a chance that the tumour can grow back and you may need to have it removed again at one point in the future. They did say that other options could be, if I didn't want to have the surgery or the medication, you can also have radiation therapy, which is obviously what is used in cancer patients alongside like chemotherapy. So yeah, radiation therapy is an option for me in the future. But with radiation, they did say that with my age at the minute, they wouldn't really recommend it. It would kind of be like a lot more years in the future that they would kind of prefer it to be done. I think that's everything in terms of like diagnosis and symptoms. Obviously, if you've got any questions, please let me know. I have been sharing my story on TikTok and kind of giving like recovery updates on there. And I've been surprised at how many people are kind of going through the same thing that I was, because genuinely, I couldn't really find anyone talking about it. So yeah, if you are going through this, please know you're not alone, and it does sound really scary, but I promise you it's not as scary as it seems. And in terms of long-term medical appointments, I initially thought I was asking a question. I was like, oh, so it's going to be like, what, 15 years? And they looked at me and they were like, no, 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 you have these appointments for life now. So at the minute, I think I've got to see the neurosurgeon in a few months, but I think once they're happy with me and discharging me, it's more endocrinology that I will have to see for the rest of my life. And also I will have to get eye tests and MRIs for the rest of my life. But I think initially it will be like every year or so, and then if they're happy, then it can be reduced to then every 2 years up to 5 years or so. They haven't actually specified like how often it will be in the end. But yeah, that is I did get told in my last endocrinology appointment, she's like, we're going to see you for like the next 80 years or so. I was like, great. I have had some complications since surgery, so I will talk about that in my next video and like what the recovery will be like. But yeah, if you've got any questions about anything, then obviously please let me know and I'll do my best to help you.